9:06 the time. News Talk 1270 KIML, the radio station. My name is Glenn Woods. Thanks for joining me. 682-1270 is the phone number. And as always on Thursday, special guest joining us from Wyoming Liberty Group. Hi, Regina. How are you this morning?
I'm fine, thank you. Good to be here.
Good to see you. And I am looking forward to this because we were chatting a little bit. I was chatting a little bit online with Maureen, and it sounded like for once, Wyoming Liberty Group has some good news out of Cheyenne. What's going on down there?
Some neat things, actually. We talked last time about a couple of bills that were kind of still making their way through the legislative process. Right. It looks like, and we will know by the end of business today, in other words, upon adjournment of the session today, whether or not those bills will make it out of committee. My hope is that they don't. So those bills, of course, create a managed care program for Medicaid. The problem with that one is that in addition to all the current Medicaid costs that we would pay for Medicaid recipients, these plans, being that they're managed care plans, are contracts through private insurers, and you have a premium tax. So the state of Wyoming would pick up that tax as well.
How many people, I look at the size of the state of Wyoming and I think, well, we're not talking about a whole lot of people here, but still, though, how many people and what would the cost be?
You know, they have a fiscal note on the bill. I haven't looked at it in detail because I am so concerned about just the public policy approach to it.
Right.
But, this would be for the existing Medicaid population, and we know that those costs are currently, $500 million for the Medicaid program in Wyoming. Isn't that our share? I believe it is currently. So you would assume that those costs continue and that they'll inflate as they do every year. They're uncontrollable. And then in addition to that, all of those plans for managed care, we would pay a premium tax on. And that's because Obamacare has created these premium taxes for all plans. That'll start in 2014. Oh. Those are the taxes that are passed on to all the consumers.
Well, a couple of things on that. Well, first off, I heard you say, so they're uncontrollable. Why are they uncontrollable?
The costs, the Medicaid costs, Medicaid program costs. As you know, Medicaid has been a huge budget, fiscally, a huge budget concern for all the states. It eats up a tremendous amount of their costs. The reason why those costs are not controllable is because the people receiving the health care do not pay for the premiums. They do not pay for the health care services. So there again, when you have consumers removed, just like they're removed now in the private sector, we don't know what a office visit is. We just go in and we're supposed to pay our deductible amount. So when you don't have consumers in control, you don't have consumers that give you those price controls like we do with other things, you're going to have the providers and the insurers come get together, make the contracts, and set those prices, and they can ratchet them up year after year after year.
Right. Every time
that's why they're uncontrollable.
Yeah, and every time I've noticed this, I've seen many studies on this as well. Every time you have sort of a blind box when it comes to the cost of anything, really, where people don't know what they're paying. The doctor doesn't know what he's charging. People don't know what they're paying for it, but somehow it all gets paid for. The price always gets ramped up, doesn't it?
It does. Absolutely. And that's not going to change. That will not change under the Federal Health Care Act. To give you an illustration, I thought I should bring this up. Romneycare in Massachusetts. There's an article out, a couple of weeks ago. Guess what's happening in Massachusetts? Their Democratic governor is having to raise the state's single rate income tax by 1% to help cover the cost of this affordable universal coverage program.
I was living in Massachusetts. Well, I was living in Massachusetts.
And this is what's like.
Well, I was living
41%.
Oh, I'm sorry. Go ahead. I'll let you talk.
Yeah, 41% of Massachusetts' budget right now, today, goes for Romneycare. And they're saying by 2020, 2050 or even sooner, it'll eat up 50% if it just continues growing as it is now. 41% of a state's budget going for health care.
See, what got me was I lived in Massachusetts when Romneycare came in, and right away I said to people who were living around me, the very liberal people that I knew, well, this is going to double in cost within the first year, and they're going to be asking for more money. They told me I was full of it, but that's exactly what happened. And then at some point, it's going to become a massive part of the budget, and eventually you're going to have no choice but to shut the whole system down, which is what they're getting to now. What really killed me is when Romney was running for president, he was still touting this as a great idea, which but this guy was sold to us as the conservative.
Right.
Now let's take Obamacare in the state of Wyoming and Medicare. What does that mean for us here?
In Wyoming, we did not expand Medicare or Medicare or Medicaid.
Medicaid.
Okay. We did not expand Medicaid, so that we were looking on an additional 10,000 people, and those people would be with incomes at 138% of the federal poverty level. In Wyoming, that for a family of four, for example, at 133%, let's just use that, is $30,000.
Right.
So everyone in a family of four in Wyoming, $30,000 would be enrolled in Medicaid if they choose. Remember, people are not automatically enrolled. They have to sign. They have to choose. They have to do that. Wyoming people, there's a significant number of them who have said, we don't want to be part of the Medicaid program. So we'd have that. So we did not very wisely expand our Medicaid role. Then, so we have a reprieve there. But if we pass Senate File 60, which I think is out on the House floor now, if we pass that bill and Medicaid managed care plans go into effect, we will not see cost reductions at all. There's 48 states that have managed care plans, and none of those states have reduced their Medicaid costs. And we know that managed care in the private market doesn't work either. The state employee, which is an ERISA, self-funded plan, is a managed care plan, and it has not controlled costs. We actually had a reprieve last year, lower health care costs, because people stopped using the services. And that's exactly where the price controls come in. When people stop electing to have services, you'll see the prices stay down, because doctors and hospitals would like people to come in and elect to have a surgery, elect to have something fixed. So you want to keep the prices down to where they're attractive. When people are taken out of that loop and it's just between the facility, the provider, and the insurer, no cost control, ever.
Well, now, see, and for me, of course, now this is the way I'm just independent-minded like this. If I do any kind of business, as much as I possibly can, I just do it in cash up front, because that keeps my cost as low as it can possibly be. Though a lot of people like to go through these government programs, which to me seem to be not just more complicated, but always more expensive. So I look at this and I'm confused and I scratch my head, not because I'm not a smart guy, I am a smart guy, but because it's a government program and who can possibly understand it? So what I got to ask you then, and I thought about this when I was looking at some of what you guys have been writing about this down there in Wyoming Liberty Group, is, so, okay, does this, what they're trying to pass right now, does this end up making it more expensive for the state of Wyoming? Do we end up owing more through Obamacare and what the legislators are trying to do in Cheyenne? Does this fix the problem? Is this just damage control? What are we dealing with here?
Are you talking about the bill, or are you talking about how we're trying to work with Obamacare implementation?
In this case, work with Obamacare implementation.
Okay.
Yeah.
Okay, yeah, no, the Federal Health Care Act does not fix anything. What
Right.
it is a cost shift. It's a cost shift from the private sector people, the middle income people who buy insurance plans, the employers who provide those insurance plans, the insurers who develop those insurance plans. It takes the money out of that and puts them into state exchange. And it does that because it allows people who make 400% of federal poverty and below, which in Wyoming for a family of four is $92,200. So if you're a family of four and you make a family, and you have this has to be everybody's income, which is another whole issue. So if you have a family income and $92,200 a year, you can get a subsidy for plans that are offered in exchange. So if your employer has a plan, and mind you, with all of these premium taxes that are coming on, and the fact that these insurance rates are going to skyrocket anyway because you have to cover everyone, you can't charge disproportionately different rates. Everybody has to be the same. So if you were on a plan for a decade, or you joined up now, you get the same rate. There might be for smokers and age, but very little geographic area, very little variation there for different rates. So everybody charges the same rate. Insurers cannot have a huge profit. I would say 80 or 85% has to go back there. So you have all those restrictions on these plans. That's going to triple the rates. They're already saying on an average 169%. 169%. So triple the rates there, and then you're going to have employers and employees say, guess what? I'm at 400%. We're going to get a tax subsidy to help pay for all of these additional costs. I'm going to drop my private insurance and go try to get something through the state, through the federal exchange, and get my federal tax subsidy. So that's where the cost shift occurs, because the people, either way, whether they're at 400% and below or they're Medicaid eligible and they jump on, you're taking money out of the free market. That free market sector is the one that's been floating our current system right now. So
Okay.
you're dwindling the money that's necessary to keep everything afloat. So what's going to happen? Are we all going to be in the exchange? How on earth are you going to be able to fund the entire Wyoming population?
Right. All right. Now, on that, we got to get back to that bill, but I've got to pay some bills first, and then I've got some quick questions about that bill. And what's the number of the bill again? So those people, because I know a lot of my listeners like to look things up.
Senate File 60.
Senate File 60. Okay, you
Senate
guys,
File.
and we'll talk with Regina a little bit more about Senate File 60 and what it does in just a moment. And of course, 682-1270 is the phone number, 307-682-1270 if you're outside the area code. I'm talking with Regina from Wyoming Liberty Group. We might have a call on the line. This is Glenn. Who's on the phone? No, they dropped off. Okay, maybe they'll try back just a little while. So for those of you who are just joining us, we'll get Regina here to explain to us again in a nutshell, what is Senate File 60? What does it do?
Senate File 60, it creates a Medicaid managed care program that will add additional premium taxes on top of the Medicaid costs that the state already has to pay for.
Okay, now in your opinion, is that good or bad or just damage control?
It's not damage control. It's actually bad, because Wyoming is one of the very few bare bones Medicaid programs. So that's why we haven't had the horrific financial problems that other states have. The two problems with it is that the managed care adds additional costs. You're going to pay for those premiums associated with those private contracts on those plans. And then managed care, as a general rule, has not produced cost savings in anything. Those plans have been in effect for decades, and insurance costs and health costs continue to escalate.
Okay, see, I keep looking at this thinking, how come these guys, and maybe you've heard something that I haven't, never offer up a free market solution? It's always these government managed care solutions.
Yeah. And it's interesting you bring that up. Governor Rick Scott in Florida has expanded Medicaid. That's not the whole story. What he has done is he's finally gotten approval for that Florida started a couple of years ago to do Medicaid managed care plans. Yeah. And so what they were doing under that is expanding the Medicaid managed care plans to maybe up to 250%. I haven't looked at his at the application specifically, but I think generally that's where he went. So, and if he put it up to 400% or whatever, that's where they're going. But Wyoming would be leaving Medicaid care for our current population, which is for some people 133%. So we have the bare bones. So that's really what he did. Is he's expanded the Medicaid managed care program.
All right. Well, now he's got other problems down there in Florida with, for example, 17 million people. A good chunk of them retired. Although there is a lot of money coming into that state, though still with the number of retirees down there, in the long run, when the money runs out, I think he's in a whole lot of trouble.
He is, and I'm glad you brought that up. There's something else that Wyoming Liberty Group has been talking about and wants to start the conversation on, and that's the shift in demographics in the United States and actually globally. And what we're talking about when no one's expecting. And the gentleman's name is Jonathan E. Last, L-A-S-T. He talks about the fertility rate.
Okay. Wait, hang on just a second, Regina. We just got to pause for just a second here because your feed has suddenly bunched up, and I'm going to let it rebuffer real quick here. Okay, give that a try. We'll start with that gentleman's name again.
Jonathan V. Last.
Okay, now I got you. Go ahead.
S-T, in case anybody wants to look at the book. It's a fascinating book. Jonathan looked at fertility rates are essential for any country, for any population, to replace the number of people who die during any given period of time. So the golden number for replacement rate globally is 2.1. So in other words, a woman of childbearing age, I think it's 15, 16, 17, 18, between 34, that period of time. They look at how many children that woman has, and you need to have 2.1 children for every adult female in order to stabilize the population. Currently, the United States is at 1.94. That's our fertility rate. And we know, we could see it in our own families, we see it in our neighborhoods, people are having less and less children. What that says and how that directly affects the funding of entitlements, Social Security, Medicaid, Medicare, CHIP, all of those things, pension plans. What this says about the funding of those things long term is that there are less people paying into the system to support those that are drawing the benefits.
Right. Okay. Population aging, more people collecting than paying into the system. So once again, you're caught with a Ponzi scheme that, of course, always crashes in the end.
Yes, and that's where we're headed. And right now, we're in the United States. We are in a diamond shape. You have the baby boomer population, and as it continues to move up to be the people who draw the benefits, that pyramid will invert and will be down to one or less people funding 5 or 6 or 7.
Will you be writing?
It is understandable.
I didn't see it early this morning, but will you be writing any more about what you were just telling us today and posting it on Wyoming Liberty Group?
Yeah, possibly. I actually have a little announcement to make. I will be co-authoring a book with an oral surgeon in Casper, Dr. Jim Ripley. He is with the Wyoming Specialty Dental Centers of Wyoming, and he currently publishes commentaries with the Casper Star Tribune. So we will be co-authoring a book on healthcare. What went wrong? What's the problem? What went wrong? How did we get here? The role of politics, discussing the funding, discussing what America needs, and finally getting down to some real solutions. And a lot of them are, of course, in the 5-step plan. There will be other solutions because everyone knows, Glenn, we cannot continue to operate our healthcare system as we do currently.
Well, everybody knows that. They keep passing more laws, apparently.
Yeah, they're not accepting it. And that's the difference between Wyoming Liberty Group. We need people to understand exactly where they're at because they're going to have to make some real decisions. And versus the liberal side that's just saying, no, believe in us, believe. Well, it's coming to a point where you can no longer accept that.
Sooner or later, the money runs out. Well, when is that book going to be out? Do you know when you're going to be able to finish it and when it comes out?
Well, we don't even have the set amount of pages. Our philosophy is we're going to have to write the book until the story's told. It has to be complete for people to understand. But maybe around January or so.
Okay. Well, as
maybe
soon as
this
it
summer.
does, some of the publicity, I just might suggest, let's say, a radio station north of you with a morning talk show that you might want to go ahead and get booked on to give some publicity for the book when it comes out. Just tossing that out
Absolutely.
there, Zan. Okay, I got to run to sports. Good to see you again. If you get more information written up about what we talked about today, just let me know. Drop me an email or on my Facebook because I've got a new regional page now, and a lot of articles from Wyoming Liberty Group are on my regional page, so people can keep up with you guys. So please let me know when you get those up.
All right.
Okay, good to see you again.
You too.